It's a Friday. Hello there. Thank you for joining us from wherever you are. We're coming to you live from our studios in Kokomlemle on digital address GA 09925339. Our top stories this hour. Ghana's coronavirus cases rise with 313 cases as the figure reaches 7,616 and all but one region record cases. We'll bring you an update of those in critical condition from the person in charge of the treatment centers. Also coming up, chaos in the U.S. city of Minneapolis as houses and vehicles are set ablaze. Police clash with protesters and CNN crew is arrested. It's been days of violent protest after a black man dies in the hands of a white police officer. We are live in the United States of America. Also coming up, domestic abuse case rises with the arrival of COVID-19, tipping off an emotional instability. This afternoon, our big conversation is a date with marriage counselor and founder of Royal Ladies, Reverend Mrs. Sam Kwanche Ankra. Your questions, would love to help answer. Join us on DSTV 421 Go TV 144. Remember, we're streaming live on YouTube, and you can send your thoughts and opinions on 0540109009. Your questions are also welcome. My name is Gifty Andopia. This is The Pulse. You're welcome. Well, I'll take you through the details of those stories now. We'll take a look at the case count so far. More than 7,000 cases. In fact, more than 300 difference in what we knew yesterday before we went to sleep. Head of our health desk, Fred Smith, is here in the studio to help us with the breakdown. Fred, over 300 new cases.
Yes, 313 new cases were recorded over the last 24 hours. It brings our total case count to 7,616. And of all of this, we still have the deaths standing at 34. The recoveries, as we speak, currently 2,421 people have so far recovered. And Gifty, the current active cases as a result of this is 5,161. It means that 5,161 people are still under treatment for COVID-19 in Ghana.
Okay. In that case, do we have an idea what the regional breakdown looks like at the moment? Well,
indeed, the Greater Accra region, we know, has always been leading in this because of the special role it plays in our nation's geopolitics. So, as we speak, we have 5,331 persons who have contracted COVID-19 in the Greater Accra region. The Ashanti region follows with 1,160 cases. Then it's followed by the Western region with 395, Central 376, then Eastern region with 117 cases. Then we have the Western North region with 63, Volta region 59, Northern region with 36, Oti region 26, the Upper East region 26 as well, the Upper West region with 22, Northeast region with 2 cases, and then we have Savannah, Bono region, and Bono East, giving you 1 case each for all those regions. And the number of regions I've mentioned to you now, Gifty, amounts to 15, and it means that we still have 1 region without a case as we speak. Then that will be the Ahafo region. I
like the way you put it. It means that we still have 1 region that has no case. This was the case about 2 or 3 weeks ago, but it took just a few hours for that to change.
Indeed, as of yesterday, we still have 2 regions without cases, and that has also gone into it. And so we now have just 1 region, and the prayer is that we don't record any case in the Ahafo region.
Oh, people have said that it's just a matter of when and not if, and so for us it's a matter of deciding what lessons we take from those few who didn't, or the regions which didn't, which eventually recorded, and how we can stop that from spreading. Fred, what do we know about the global outlook?
Well, in terms of the global situation, we have 5.8 million cases around the world so far. Those are the persons who have contracted the disease so far. 360,000 people have died, and this information is according to the Johns Hopkins University dashboard. And Brazil is one of the places where the WHO and other health professionals are worried about, because the infections are going up really fast. It is currently the second highest after the United States in terms of number of cases and the number of deaths. And so Brazil is a big worry to the global health systems. But we have Spain, Turkey, France, the UK, and Brazil. They have all announced that they're going to ease or lift the restrictions, at least partially, in all of these countries, and that is a bit of a worry. Restrictions are also easing in Asian countries such as the Philippines and Japan, and as you know, efforts are already underway to ease the restrictions here in Ghana as well. But in South Korea, that's where the interesting thing is, because we've always known South Korea to be the model for managing the COVID-19 situation. They were able to bring the situation under control in a very short time. So they lifted the restriction, and within a matter of days, they are reimposing those restrictions as schools are being shut from today. And why is that? It is because of a resurgence in cases after lifting the restrictions. And so it's important to pay attention to certain things before the lockdown or restrictions are lifted, whichever country. And in the case of Ghana, we know some effort is underway to get our mosques, police stations, markets, and other places disinfected before any announcement of the lift of the restrictions.
Well, we'll see how that goes. Fred, thank you for that update. Fred Smith there with the update of our coronavirus cases. He's head of our health desk. Now, doctors and nurses at Komfo Teaching Hospital are kicking against a move by management to introduce cloth face masks for clinical duties. Leadership of the Ghana Medical Association and Ghana Registered Nurses Association insist the use of unapproved and unsafe protective gear will endanger the lives of their members. Love News has intercepted a jointly signed letter by the two groups in protest of the management decision that they describe as dangerous. Ashanti Regional Chairman of the GMA, Dr. Pakwesi Bedu, has been speaking with Erastus Asaredonko, who has filed this report.
For good quality personal protective equipment for health workers has soared with the emergence of COVID-19. Many frontliners have been exposed to risk of infection, with 20 of them having tested positive to the virus so far in the region. A letter dated 24th April 2020 by the Trauma and Orthopedic Directorate notified all clinical teams of availability of cloth masks, particularly for staff at low-risk COVID-19 areas of work. The announcement has been met with stiff resistance from the front of the various health staff associations. A written response dated 22nd May 2020 by the Ghana Registered Nurses and Midwives Association registers their disagreement to the use of cloth masks for clinical duties. Leaders demanded scientific evidence of effectiveness of cloth masks in preventing infections in such environment. Dr. Pakwesi Bedu is regional president of the Ghana Medical Association.
I agree with the GRNA. We were urging the various hospitals, nurses, doctors, to insist on getting the right PPEs, because as you remember, Ghana Health Service is wondering why so many healthcare professionals are getting the viruses. And if you talk to the administrators, they will tell you nurses, doctors, pharmacists, or healthcare workers in general are not getting the viruses from the hospital. You see, they are denying it, trying to, when you tell me they don't think those who had it got it from the hospital, you are shifting the blame. And it's on this basis that I, as the divisional chairman of the Ghana Medical Association, and based on the evidence that is available, we're demanding that if you, whichever hospital you may be in Ghana, when your managers tell you to use a cloth mask in theater on the wards, they will always tell you it's been approved by FDA. And I associate myself with what the nurses, the Ghana Registered Nurses Association has written. They should provide the evidence. They said FDA. They should provide the evidence so that we scrutinize it. When was the test done? Sample size. What was the methodology? So that we can scrutinize this. And if it meets the criteria for safety, then we can do it. But it's not just enough saying FDA has approved it. Mind you, use the cloth mask, the white ones that are being given the hospitals. Use it and see whether it will be easy breathing through this. And I just finished a 5-hour surgery. If you have that one, I'm sure by the time you are done with it, you'll be sick yourself, because you see, exchange of oxygen is so difficult. So you may be taking in the carbon dioxide you are breathing.
Hospital management will not immediately comment, but close sources say adoption of the cloth mask is backed by authorization by the Food and Drugs Authority. Dr. Park Kwesibedu, however, insists such approval is not enough.
The list, you see, we will all prefer the N95 with the goggles, screen, and all that. But if it's not available, the list we will demand, or we are asking for, is this surgical mask. This is not even foolproof. Some research will tell you viruses can even pass through this. And what's more of the cloth mask? So they should make sure they protect their workforce.
A 2015 randomized trial of cloth and medical masks for healthcare workers by physicians at Kirby Institute at the University of New South Wales found higher rates of infection in cloth masks. Reporting for Joy News, Erastus Asaredonko, Kumasi.
And we'll still stay a while longer in the Ashanti region. Lack of space is compelling authorities at the psychiatry department of the Konfanoche Teaching Hospital to run its pharmacy from a pantry. A section of the specialist outpatient department pharmacy canteen is also used for storage and distribution of drugs. The situation raises serious concern, especially about adherence to COVID-19 protocols. Nana Yaojima visited the facility and has this report.
Two people who man the pharmacy here struggle to maintain an appreciable distance between them. Through a small window, they manage to serve hundreds of patients who visit the facility on a daily basis.
So this is actually supposed to be a kitchen for one of the departments here at the Konfanoche Teaching Hospital. But due to space challenges, part of it is now being used as a pharmacy for the psychiatry unit. Not all the essential medicine are able to be stocked here due to space. Dr. Courage Danku is senior specialist in psychiatry pharmacy. He has been speaking to me about impact of this on the pharmacy.
There is huge instance of medication adverse effects, especially with the psychotropics. So we will need a space to meet these patients and then the caregivers, even on OPD basis, to be able to interact and explain and give them insight into the whatever chemical they are taking. And the space even now, hitherto, is also too small to even accommodate two professionals in the room, let alone the patient.
From the balcony of the building, a seated client interacts with the doctor who is in his office. It is another improvised consulting space, at least to speed up work under such challenging circumstances. In one of the rooms, I find two doctors share one table. Two screens separate them, from occupational therapist on one side and the room for nurses on the other. Three doctors use the conference room here in breach of patient-doctor privacy and confidentiality. Head of Psychiatry Unit, Dr. Ruth Oswentry, speaks about the impact on healthcare delivery.
People come and they want to get the privacy to share the full-fledged of their troubles and their problems. But if they turn left, right, and there's another patient sitting in a hearing distance, then they keep some of the symptoms within. We have a problem with space for even our occupational therapists. Some people just go through some form of trauma that they are unable to speak about their problem. The art therapist takes them through drawing such that they draw whatever they are going through on paper without even talking. And she has to sometimes wait till all the OPD clinic is done before she starts her services. And some people will not find the time favorable.
Both male and female wards accommodate just 11 patients, as many of those who require admission are managed from home.
This is the only specialist psychiatric unit in the entire of the Middle Belt going up to the north. We even get cases coming in from neighboring countries. But when they have come all the way here and the patient's condition is severe, that needs admission, for instance, there are times the ward is full and we may have to turn this patient away. We may ask them, go back, use this medication, come back in a week's time. Maybe by that time there will be space on the ward. Or sometimes they come back in even a worse form than they came.
The psychological impact of COVID-19 has resulted in increasing attendance at the facility. So what responsibility does this place on caregivers? Dr. Daniel Fojo attempts an answer.
We need to have particular facilities to give the best psychological services that can be given. In itself, we can actually give the psychological services that is the top-notch, international standards. We sometimes find it's so difficult to give some of these ones, so we try to do preliminary ones.
Until something drastic is done, space will continue to be a challenge for the center responsible for proper mental function, even post-COVID-19. From Kumasi for Joy News, Nana Ojima reporting.
And from Kumasi, I'm going to go on a very short break. When I return, we'll talk about the impact of COVID-19 on relationships. I want you to share your thoughts with me. If you have any questions, I have a counselor here in the studio. We want to hear those questions, and I'm sure that we'll get you answers. This is still The Pulse with me, Gifty and Pia. We'll return shortly with more. Do stay with us. Welcome back to the show. It's good to have you. Let's talk about coronavirus and the impact it's had on relationships, emotional balance even. COVID-19 pandemic, as you know, it has been disrupting the daily lives of people all around the world. Experts have said that this outbreak has profoundly affected our social relationships. Last week, we started a conversation on how our lives have been impacted since COVID. Today, we continue that discussion on the impact on relationships. Which ways are loved ones staying connected? Are people feeling more or less connected to others? How are couples feeling about working from home together? What are the effects of of people working full-time from home whilst also caring full-time for their children because they're not in school, remember? What are the effects of living alone right now? Not forgetting new job losses and the impacts that they've had. Join the conversation with me right now on our social media platform, WhatsApp. There is the number right there on your screen, 0540109009. I have in studio with me Reverend Mrs. Rita Crunchy Ankra. She's a Premier Lady for Royal House Chapel International and President General and founder of Royal Ladies Ministry, RCI, and the wife of Apostle General. I'm sure that you know him and you know her as well, hopefully. Mama Rita is how she's favorably called. She counsels a lot of people. She's recently been doing series on this as well. Mama Rita, you're welcome to the show.
Thank you, my darling.
It's good to have you.
Thank you.
Coronavirus is here. All of a sudden, our lives have changed. You were just sitting down, and that was the very first comment that you made. Our lives have changed. I usually like to get personal with people. How has it changed for you personally?
For me, it's a terrible thing now. As a mother of a church, as a pastor's wife, I'm supposed to do counseling. I'm supposed to be praying for people. I'm supposed to be visiting people, giving them food, giving them comfort. I still do it anyway, but sometimes you go into homes and you are scared. You know, you come back and it's like, oh my God, did I catch the virus? You come and you are gargling with salt water and you are bathing with salt water and you are taking lemon and warm water, you are taking ginger and garlic, and you know, our lives, it looks like our lives have changed forever. So for me as an individual, trust me, it's not easy for me. People come to me for counseling all the time. Sometimes you feel bad when you want to overprotect yourself. You don't know what the people are thinking. Or do they think I have it? And you know, sometimes you want to pray for people and
you have to observe social distance.
You have to observe social distance. Psychology also says that a bit of touch brings healing, brings emotional comfort. People are used to me hugging them, and all of a sudden they come to me, they want a hug, and I said, oh, no, it's terrible now.
It's terrible.
It's terrible now for me, and it's also terrible for families.
Okay, so usually counselors, you will say, are equipped with the, I mean, we're all human beings, but counselors, because of their training, because of the grace of God, as we believe, those of us who are Christians believe. Okay. All right, so usually for those of us who believe, we hear that counselors are well equipped because they have the grace of God. It's a calling for them. They've trained, so they become very good at it. It will still take an emotional toll on you. I am wondering, even for you, it is terrible. So how much more or how much less will it be for other people who are not trained, who are not called to be counselors? What sort of stories do you hear in your counseling session, especially these days, especially among couples?
You mean for me or for the other counselors who are not trained?
As a counselor.
Oh, okay. The stories are here.
Yes,
oh
I mean, what sort of stories are coming up with this new season?
Oh my God, as for the stories, some of them are so emotional. Some of them will make you tear, trust me. Over the years, people haven't gotten used to, you know, staying together for so long. They work for 8 hours, they come back after work, some of them visit a few friends before they get home, and then all of a sudden you are working from home. You have to see your husband or you have to see your wife 24/7. I'm telling you, for couples or for families that haven't built their relationship, they are going through a hell. They are going through a hell. Between my husband and I, we are very good friends. Between my children and I, we are very good friends. We talk. So it's not strange all of a sudden being locked up in a house together. But just trust those who haven't built their relationship. They haven't built their friendship. They haven't built their conversation. They haven't built their communication. And all of a sudden you live in a hall and a chamber. Husband, wife, 4 children or 5 children, staring at each other 24/7. My darling, people call me all the time. My husband is slapping me. My husband is beating me up. My wife is abusing me. My wife is disrespect. I mean, things we haven't heard for a long time. All of a sudden, it's happening. Children are getting so emotional. They are so stressed up. And parents don't just know how to also handle the children. The children are used to going to school, being in a classroom, there's a break, you are chatting with your friends, you are catching up with what is the latest in town, and all of a sudden you are with your old school parents, and there isn't much to talk about, and you are wondering what is happening. And because parents do not know the stress that children are also going through, and the emotional, you know, they're also going through emotions, you know, and they are going through a lot of stress and all that. Parents do not know, and parents are screaming and tidy up your room, come and wash dishes, and you are not helping me in the kitchen, and what are you doing with your life, and you are sleeping too much. So parents are going through emotions. Children are going through emotions. Children do not understand their parents, and then parents as well do not understand their children. Husbands don't understand wives, and wives don't understand husbands. And then to add up to it, there isn't money. People are losing their salaries. People are being paid half. You know, it's a lot. It's a lot. You know,
for the people who call and say, my husband is slapping me, my wife is abusing me, what sort of, and I'm sure there are people in our audience who have these problems, what kind of advice do you usually give them?
Well, the first thing is to get both of them, talk to both of them to calm down, find out what the problem is, and blah, 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 blah. If it's something that is solvable, you solve it. For the first instance, you know, we warn the husband, we warn the father. But the second one, when I receive a second call from the same family, trust me, I call the police. During the lockdown, I had to call the police several times on certain fathers. Because some fathers were so abusive, some husbands were so abusive. I mean, I literally had to drag some of them to the police station to be locked up.
Will that not affect the relationship between the families and then also between them and you? Because then they'll feel like you are Mama Rita, you are supposed to be counseling us, and then you report us to the police.
Oh yes, the first time I warn you. The first time I warn you and I tell you, if it happens again, I'll call the police. So before I do it, I would have warned you already. And most times, you don't just leave them like that, but after then, you do a bit of counseling, you do a bit of therapy, and it works so far.
Okay. Let's treat the parents and then we'll get to the children. You talk about parents going through emotions, children going through emotions. They don't know, they don't know how to deal with it because over the years they've not been together for so long. Now all of this is in one place. How do parents, are there any tips that you can share with parents in these times of how they can, so that's parent, and by parents I mean father, mother, between the two people, what are the things that they can do right now?
This is the best time to have family bonding. You need to bond with your children. The first thing is communication. I advise parents to communicate with their children. Okay. Like I said, the children are also going through emotional stress. So communicate with your children, chat with your children. This is the time to build your relationship with your children and make sure that, you know, things are okay with them. What are some of the ways you bond and you go through, you know, oneness with your children? Like I said, the communication. When you are cooking in the kitchen, call them around, let them help you. I like to take a bit of vitamin D every day between the hours of 9 and 11, and I'll make sure that I call my children, especially my last one. She's still a teenager. I call her, come, let's sit down, let's receive vitamin D together. And whilst we are doing it, I'm chatting with her, finding out what is happening in her life and what is going on, and about school and about studying and, you know, blah, blah, blah.
Does she tell you, or is there a specific way you do it that gets the information out of her?
Oh, yes. I don't know whether to say you need to be trained, but I believe that every mother is trained. Every mother has that inbuilt
ability to get information from
information from
children of today.
It depends on how you go about it.
Okay.
If they know that you are there for them, if they know that you won't judge them, a lot of the parents are judgmental. A lot of the, especially mothers, when they are, remember that these children are smart. The children of today are very, very smart. Whilst they are talking to you, they are also looking at your gestures. You are looking at how you behave. They are looking at your facial impression. So they say something, they stop.
Next time they won't come to you again.
Next time they won't come again. One time my daughter, my last born, she was then, you know, in secondary school, then came to me and said, Mommy, do you know about I keep forgetting the word.
Okay.
Blow job.
I didn't say that.
You didn't say that, I did. I've been trained to say I'm like a nurse. I say everything as it is.
Okay.
Do you know what it means? Do you know about blow job? Okay. I said, what it is? She said, Mom, you didn't know. I said, no, what is it? She said, oh, when the girls, you know, suck the pencil of the females. I said, oh my God, so who taught you this? He said, Mommy, you can't believe it. Some of my friends are doing it. I said, oh, wow. So when they talk to you, what do you tell them? Do you tell them it's wrong? Do you tell them they are too young for it? Do you tell them it's sinful? Say, Mommy, if I go into sin area, they won't tell me things. But I just tell them it's wrong, they are too young for it. They could get in trouble with school authorities, blah, 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 blah. So when they start telling you this, don't act like you are too shocked. Don't be too old school. Come to their level. Once you come to their level and you behave like you are a friend, then they tell you more. My third born, anytime she comes from work, I go straight into her bedroom and we start talking. So you and your boyfriend, what is happening? You and your fiancé, what is happening?
Isn't that prying into their
No, I try to help her. Okay. I don't want her to go overboard. I don't want her to go beyond her limits. I don't want her to make mistakes. Sometimes we allow them to make mistakes before we come in. But you try as much as possible that you don't let them get to where they must make a mistake, and then where turning back becomes a problem.
So as a parent, where is the line drawn between being friends with your child, your children, and being unnecessarily intrusive? Yeah, into their life, protective as well.
I don't think any parent should be, I wouldn't say every parent must be protective. Protective in the sense that you are checking the kind of friends they have, the kind of friends that come home, the people they go out with, the people they mingle with, the kind of places. My daughter, the one I'm talking about, she's 26, trust me. When she goes to work, I call. Are you at work? Is everything okay? I know the time she must close. If that time she hasn't come home, I call.
Isn't that too much?
No, it's not too much. It's not too much. I keep telling them, when you start also having children, you know it's not too much. My mom used to do it to me, and I used to wonder, well, you know, she says, I'm only being sure that you are okay and all that. It's not too much. Okay. It depends on how you go about it. Like I said, don't do it too much. Let there be a line. Let her know that you care. Let her know that you're a friend. Let her know that, you know, you are only guiding her so she doesn't fall into a ditch. Yeah. Once she knows these things, trust me, it should be fine.
Well, let me not hijack the show with all my questions. I'm going to open the phone lines and allow you to call in.
Wow,
ask your questions. I actually do have some here. This one says, in fact, it has a serious impact on our income, and homes are becoming bitter due to insufficient financial support. From King in Russia. So I will if there are questions about finances, I'll have us talk about it, you know, separately. So there is this finances that's coming up. How do you deal with it if the money coming in isn't enough and it's putting stress on the emotional? This one says, I'm Emmanuel. My wife had been out from me because of COVID. She's at work for the past 2 months. It has not been easy for me at all. I'm going through emotional stress. What must I do? I am prostrate patient, and I need my wife with me all the time. Where is the case? Here's the case. She has to be away for 2 months. Please help me. So if your wife is perhaps a frontline worker, or your wife works, you know, within that, I'll have you answer that, and then we'll open the phone lines for now. So finances, how do you deal with the financial constraints in these times?
Finances, I always believe that you need to cut your coat according to your size. When things are okay, we have all learned how to eat in restaurants and all that. But when things are not okay, you cut. You cut. Your salary has been cut. What do? You plan. You plan your day, you plan your week, you plan your month. Certain things that are not too important now, you hold on to it. I don't expect people buying clothes at this time.
Okay. I've been buying some clothes.
Pardon?
I've been buying some clothes.
Because of your show.
Okay.
I expect that you should be giving clothes allowance. So if your bosses are listening, they should be here.
I won't comment on that.
So I don't expect people to be buying clothes at this time. Whatever you have, strictly must be for food. Strictly for food.
For now.
For now. Buy a bit of rice, a bit of gari, a bit of oil, you know, all that. Keep it, and then spend it a bit at a time. And then I want parents to know that children understand.
Okay.
Sometimes we think that children don't. They do.
They do. Okay. Let me just interrupt briefly and bring the caller in. Emmanuel Bulari is calling from Tamale. Emmanuel, thank you for your time. What question do you have? Is it a suggestion? Go ahead. Emmanuel, go ahead. We can hear you.
Thank you, madam. Good afternoon. I think, yes, I think what madam is saying, I think she's not too much on the girl, or we shouldn't be seen to be too much on our girl. You know, it's to monitor every child's movement so that it will help the family. My question to her, I have almost a 12-year-old girl. whose mother is not with me, though I currently have a wife taking care of her. But I want to find out how I should care for such 11 to 12-year-old girl when the biological mother is not with her.
How you care for a girl 12 years of age when the mom is not around? Okay.
Yeah.
All right. Thank you, Emmanuel, for your question. Okay. So let's use this to talk about children, managing children and their emotions in these times. And we'll use Emmanuel's question to answer that.
Constantly, you must let the child know that you love him or her. It's not a Ghanaian thing, it's not an African thing. But now we have come to realize that letting the child know continually that you love them builds their confidence. When you see children who are very confident, sometimes we think that some children are very confident, some children are outspoken, some children are intelligent. It has to do with how the parents are treating them at home. So constantly let them know that you love them. I mean, open your mouth.
The assurances that you love them.
Let them know. Open your mouth and let them know you love them. Tell them I love you. Tell them you are beautiful. Tell them you are intelligent. Tell them, oh, I know your future will be good. I mean, speak good things about your children all the time. For a 12-year-old, 11-year-old, you come back from work, let them, give a bit, hug them, give them the assurance everything will be okay. Sometimes inwardly they are also afraid. They're also afraid of things you may never know. So give them a hug, let them know you are there for them. Let them know mommy is not there, but you are there.
Okay.
If you have a wife, try and build a relationship between your wife and your daughter who is 12. Yeah. For those of you who are married, you have children, you have a wife or you have a husband, so there's a step somewhere.
Yeah, stepchild. So couples who have stepchildren.
Stepchildren. Yes. Build a relationship between your children and their step. Right. Sometimes it's not easy. Yeah. They will come home complaining. The stepmother will complain. The stepfather will complain. But when you meet the children, let them know that, listen, it's not like I'm on the side of your mom. You don't say stepmom. I'm on the side of your mom, and I'm on the side of your dad. But listen, she means well, he means well, and you know everything will be okay. Remember, she didn't grow up with you. He didn't, you know, you must be constantly assuring that child that everything will be all right.
That's another conversation that we can have another day, living with a step-parent or a step-child. But I have promise from Ayansi. I hope I got that right. I promise we can hear you. Please go ahead.
Yes, Madam Gifty. Good afternoon to you. Well, first of all, thank you for your great work you've been doing for us. My question is, if you have a child that's very disturbed, about 6 years, 7 years, and he can't sit a minute without praying, he can't sit a minute without joining a colleague, how do you go about that child? And how do you train that child?
Okay.
Thank you very much.
Thank you, too. I hear the question about stubborn children. Mrs. Williams is calling from Wager. Mrs. Williams, please, we can hear you. Mrs. Williams, can you hear me? You're on air. Okay, I lost her. Sorry for keeping you on the line for so long. Usually this is how some of these things work. So this question is about taking care of stubborn children, essentially.
I don't believe any child is stubborn. Any child that is stubborn is crying out loud. Okay. That child needs attention. That child is saying, listen, I'm here. The child is saying, you've ignored me. That child is saying, it's like I don't exist. So the child will be naughty for you just to
get your attention.
Get your attention. So if you realize that a child is being naughty, whether you're a parent or you're a teacher listening to me, any child that is naughty, the child is naughty because the child needs attention. Give the child a bit of attention, and trust me, what you think is naughty will be a plus for that child.
Okay, I hope that answers your question. Jijo is calling from Sugakofa. Jijo, please go ahead.
Yeah, hello.
Hi.
Good afternoon.
Good to hear you.
Yeah, please, I got married some 2 months ago, and we those who want to give birth, we know that it's God that gives children, but we are a bit confused whether to allow so that we can get pregnant or we should hold on for some time. I'm a bit confused.
Because of coronavirus?
Yes.
Okay. Okay, great. Great question. Okay, Mrs. Williams is back on the line. Mrs. Williams, sorry for making you hold for that long. Please talk to us.
Good afternoon.
Good afternoon.
Okay. I just wanted to ask Mama Rita.
Please go ahead. She can hear you.
Okay. I just want to speak to Mama Rita. But for a long time, I've been admiring her on the television, and I always want to meet her, but I haven't gotten the chance.
Okay.
And today, I'm glad that I can get to her and speak to her. I have 2 kids. They are little. They are 8 and 5. And the little one looks as if she's always copying what the elder one is doing.
Okay.
Copying, like that one, it seems like a mother to her than to me. Because they place, yes. Sometimes I get a bit confused.
Okay.
So I wanted to clarify that for me.
Okay, so you want to find out whether your 2 girls, one is looking up to the other as if she's a mother, and ignoring you. You want to find out if that's okay,
yes, so
or if there's something you should do about it.
If I'm saying something to her, like you ask this one, should I? Then the other one, Mommy is calling you. Listen, like she wants to confide.
Okay, so
in the
she needs approval from her sister to even listen to you.
She gives her all the things that they play with. Okay. You know, the older one has possession of it. So if you want her, then she will use that one. The older one will use that as, if you don't listen to Mommy, I will not give you this thing. You will not play with my kitchen.
That's the only time she will listen to you.
Then I'm confused because they are pastor's children. So I want to know how she
Pastor, they call them PKs, preacher's kids.
To see her, even to get her personal number, I want her to mentor me.
Oh.
So yes, I don't know whether she can privately let you give me her number.
Okay, well, maybe you should hang on and talk to our producers at the back. I'm sure they can give you some advice. Mama Rita's team, is there. I'm sure they can give some advice. Thank you very much. Mrs. Williams, she called from Wager. Okay, so Mama Rita, let's do the answers. So the sibling dynamics that she just raised, I'm sure these can come up also in these times of COVID-19 when you are at home. And now it becomes aggravated because you're saying, do this, and she says, I'm going to ask my sister whether I should do it. And then having children in COVID-19, they got married 2 months ago.
That's Jijo. Jijo, there's nothing wrong with getting pregnant now. There's nothing wrong with having a baby now. COVID-19, we don't know when it's going. For now, it's come to stay. So we need to adjust. Everybody's adjusting by washing your hands, by sanitizing, by the nose masks. I mean, we are all adjusting. Trust me, within this COVID-19, I've had to pray for so many pregnant women who are going into labor. They've gone into labor, they are back. So don't prevent yourself from getting pregnant. I know people who prevented themselves. It wasn't COVID-19 though, but they told themselves, oh, let me get to, enjoy a bit. Let me get to know my husband a bit. Let me. When they were ready, now the pregnancy didn't come. So I tell people, immediately you get pregnant, immediately you get married, at least have one.
Okay.
After getting
if you want to have kids, right?
If you want to have kids. Right. Okay. If you want to have kids, have one, and then you can wait if you want to, so that you won't have to put a stress on yourself. So with or without COVID-19, you can get pregnant and you can have a baby. With Mrs. Williams, I'm always available. Though there's COVID-19, I still do counseling every Sunday from 11 a.m. Royal House Chapel, Ahimfie. I do counseling. You can come there, and then I can also meet you. And what I can do is also to collect your number from the producers, and then I will give you a call.
Mrs. Williams, you just hit the jackpot.
Mrs. Williams, why is your little girl listening to your older girl, it means that your little girl has more confidence. Your little girl has more confidence in her sister than you. Maybe you are being too hard on her. Maybe you are not communicating enough with her. Maybe you haven't built your relationship with her. So the first thing you have to do is start communicating, start talking. When I talk about communication, a lot of people don't understand what we mean when we say communication. Communication just means chatting. Chatting means talking to your child about everything, what's going on in her life. You are watching a television show together. You talk. Oh, so how do you understand the story? And when you go to church, or now listening to virtual sermons. So how did you understand? You build from there, and then make sure that you come to her level. A lot of mothers are not coming to the levels of their children. In other words, you don't know what is current. What is current? I know what is current because of my children. I listen to them a lot. And then I know what is current. What is fashionable now? What is the in thing now? What is the new term now? What is the new dance now? And what is the new terminology now? Come to her level. Her sister is coming to her level. Her sister seems to understand her. She has a lot of confidence in her sister because her sister is doing something. Okay. See what her sister is doing and then begin to do that. Otherwise, when they get to their teenage age, you begin to have problems. Once the older one starts being naughty, the younger one will necessarily also be naughty because she's mothering her now. So now come to her level, chat with her, communicate with her. Sometimes what you do is you have a me time with individuals. Okay. So have a me time with your first one, have another me, M-E, my time. So this is my time with mommy. Have my time with mommy with the second one. Have my time with mommy. Meet them on different levels. Okay. When you meet them on different levels, you get to know them better and you'll be able to handle them on their level. I'm
sure these questions answer a lot for a lot more people, not just the people who are calling. Anthony Owusu is calling us from Kumasi. Anthony, you have the airspace. Go ahead.
Yeah, I would like to contribute. I would like to, first of all, to thank you for making sure to bring this topic for discussion this afternoon. I believe it will go a long way to strengthen the bond, as Mama Rita mentioned already. So I sincerely believe that you continue to do such a program to help at this time that of COVID-19 pandemic. So my affirmation, just to congratulate you. Thank you for bringing such a program on TV at this period. Thank you. So mine is a word of congratulations.
Thank you very much for calling. Anthony called from Kumasi. So this lady says that in my case, the main issue is that many times my husband goes out and comes in. I urge him to wash his hands because we have a 1.5-month-old baby at home. Sometimes it becomes a quarrel because of the many times I ask, please don't call this number, because of the many times I asked him to wash his hands. And I beg your pardon, that's the main issue we are facing. Wash your hands. Now that one too has become a problem at all. Okay, sorry. Let me pick Abena from Kibi. Abena, please go ahead. Abena, we are listening. Yes.
Good afternoon.
Good afternoon. Go ahead.
I'm 17 years.
Good to hear from you, Abena.
Hello. I'm 17.
Okay.
But then, before coronavirus began, my mom has been overprotective, and then she doesn't let me go out hang out with my friends. Even after BEC, I couldn't hang out with my friends. I've been indoors since. And then when I was in JHS and I was asked to go for classes, I wasn't allowed to. And now I'm indoors. I have my timetable. I have time to learn, and then I have other things to do as a student as well. But then my mom insists on me doing house chores. And if I'm I do them all right, but if I fail or forget to do one or two of them, then she gets angry, and now I'm stressed. I don't know what to do, and I can't open up and tell her to.
Oh, Abena, I'm so touched by your story. I don't know. I wish I can help. Mama Rita is here.
Abena, your mom wants the best for you. Sometimes parents have gone through things Unfortunately, parents don't open up to their children and tell their children, this is what I went through. So because of that, I don't also want you to go through these things. At 70, what you must do is to assure your mom that you are going to forever be the good girl she's known you to be. That whether you hang out with friends or not, you will still be a good girl. You will not mess about with boys. You will still steady and all that. If you forget to wash the dishes, just tell mommy, mommy, I'm sorry, I forgot to wash the dishes. And for all you know, mommy is also going through stress. She's also going through emotions. And maybe mommy doesn't have any friend to talk to. So what you do is at 17, you can also be a friend of mommy. Talk to mommy, tell mommy, mommy, is everything all right? Mommy, I'm there for you. Mommy, don't worry, even if I don't wash the dishes, if I forget, you leave it, I will wash it. Mommy, you talk to me nicely, don't worry, I'll do it. I like my children. They'll tell me, oh, mommy, don't worry, I'll do it. Oh, mommy, you are screaming too much. Oh, mommy, you are worrying too much. Oh, mommy, you are overcharging.
But that's the thing. Sometimes you can't even have that opportunity to say, mommy, you are screaming. They'll slap.
No. Sometimes it depends on the way you do it. There's a lady I handled, and I told the lady, if mommy doesn't listen, send mommy a note.
Okay.
Send a WhatsApp message. Tell mommy, mommy, I love you. Mommy, I'll be there for you in future. Mommy, remember, I'm the one who is going to take care of you in future. Mommy, I'm a good girl. I want you to know that I'm going to be good for you. So it's a two-way affair.
Exactly. So I was going to ask, what do you tell a mother like that? Please add that to the answer you give to Julia so that I don't keep her on the line for so long. Julia is calling from Latebia Koshi. Julia, what's the question?
Okay, my question is that I have a daughter, but it was out of rape and lust. So she asked of her dad during this COVID, and then I told her about that I was raped and blah, blah. All she said is, can she say that the dad is dead? And I'm like, no, you can't say that. And then she was like, she went quiet. Just this recently, she called me and said she's been talking to her schoolmates, and everything they say, they talk about their dad, and they ask her, where is her dad? And I'm like, tell them your dad is dead, but he's irresponsible. And he says he cannot. He's not going to say it. He's going to say that dad is dead because to her, she's dead. Like nothing can change her mind. And it got me thinking so much. I don't know what to do.
Okay. And did you say that you were able to have this conversation because of COVID-19? Because then you got together?
Yes, because then she was not in school. We were home. And then she started saying, okay, people have been... She asked me earlier before COVID, and I said I was going to tell her. So when she came back from school, and she said, yes, okay, so you said you're going to tell me who my dad is. Okay. And then we started having that conversation. And then I told her, this is what happened at the early stages. And then I have to give that to you. And she was like, didn't my dad take any action on the guy? And I'm like, oh, it's a family something. My story is just a long story. It's a family something. So I was young. I mean, I didn't have a say in all these things. And I gave it to her. And she asked me whether they didn't come. And she said he denied it, that he was not the one. But my daughter has got to know the dad because it's a family related. And he knows him, but he didn't know that it was the dad.
Okay.
So when I mentioned the name, he knew the person I was talking about.
But for her, she's insisting that, as far as she's concerned, the person is dead because he did not accept her.
As far as she's concerned, since she didn't take care of her, and then we have to go through one or two things. When she asked me something, we are very close. When she asks me things and I'm able to do for her, I do it. We talk a lot. But there are certain things she sees me struggle in one way or the other. And she feels very sad. She keeps telling me, Mommy, I'm there. I will take care of you. I'll buy you a car. I'll build you a house. I'll put you here. And I keep telling her, let's pray and read very well so that you pass your exams and all that.
Okay, thank you so much.
Of the dad.
Yeah, go ahead, wrap up for me.
Say the man is gone.
Okay. So thank you very much. And I mean, it looks like from what Mama Rita has said so far, you're doing a good thing. You're getting to be friends with your child. But I'd like to tell you that you are not alone. Your story is very emotional to me because my mother wasn't raped, but my mother was a single mother for a very, very long time. So I can appreciate it. I grew up not knowing my father. Wow. I went to school and I asked this question all the time. Everybody was talking about their father and I couldn't. So I can relate so much. It really touches my heart. So I take Mohammed from Tamale, and then we get some answers. Mohammed, please, you're on air.
Yeah, good evening, Kitty.
Yeah.
Yeah, I'm Mohammed Zakaria from Pong Tamale. Yes, please, I just want to... Hello?
Yes, you're on air. Go ahead.
Yes, please, I want to thank Mama Rita for this wonderful education she has given to us. I've really enjoyed every single bit of the education she has given us. And I don't know if JoyNews could have gotten a better person this evening for this particular education. As a teacher, I've learned a lot from what she's saying.
Okay.
You know, as teachers, we are in the classrooms with kids from different backgrounds. Some are stubborn, some are very gentle, some are calm. And
Mama Rita says there are no stubborn kids. The children who you think are stubborn, they just don't have attention.
Thanks for the correction. Yeah, but I have two kids. They are twins. I think they'll be turning 3 on August 7th.
Okay.
One is very calm and gentle. The other two, you are saying that she's stubborn.
Okay, we get the point.
Anything she wants, she's always on you. She's crying, you know, dragging you until she gets it. She wouldn't, you know, be okay. I just want Mama Rita to give an advice as to how I can get her to, you know, be as I want her to.
Okay. All right. So, all right. You're welcome.
I'm still on.
Yeah, it's all right. We'll hang on a bit more with the calls because I have a number that I want Mama Rita to answer. So there was a lady who asked a question about washing of hands. She said it's creating stress in her home because she's asking the husband to wash the hand. The husband is getting angry. And then this lady whose child is asking for the father. She says she was raped. And the child is asking for the father. She's trying to find out how she can deal with this. And then you heard about the stubborn kids as well.
The first one. Naturally, men are stubborn. I mean, naturally.
Very, very stubborn.
Men are stubborn, except my husband. What you do is, if you've spoken once or twice about washing of hands, and he's not doing it, what you do is, immediately he comes home, get him a bowl of water. I don't think that if you get him a bowl of water with soap, he won't wash his hands. But if you ask him to go and wash, because men are naturally stubborn, he might think you are nagging, he might think you are complaining too much, so he won't do it. So when he comes, just get him a bowl of water, let him wash his hands, and then matter close. I believe if you do it once, twice, 3 times, he gets the message. You don't talk about it, you just present the water to him and say, my darling, wash your hands. He will get the message, and then he will do it.
All right. So let's talk about the single mother who doesn't know how to communicate. Well, she doesn't know what to do with her child who keeps asking about the father because she was raped and all of that. The child says she tells her people that her father is dead. Just because as far as she's concerned, the father is dead because he's not in
But
heaven.
I thought she said she's told her daughter now.
No, she didn't tell her that she was raped, but she said the father did not accept responsibility.
Oh, okay.
And she's saying that the girl has got to know that so and so is my father.
Okay.
But as far as the girl is concerned, the father is dead because she did not accept responsibility.
So I don't know how old your daughter is, but if she's old enough to understand, she's a teenager, let her understand and let her know what happened. And sometimes it's good to let her know, or just say, you know, you got pregnant and the father refused responsibility. So when people ask her in school, where's your father? My father is not in my life, that's all.
Okay.
As to whether he's dead or not, my father is not in my life. Okay. She's known the father. If you like, you can introduce the child to the father now, But if the child doesn't want it and wants it as, I mean, she wants to feel that my father is dead, let it be. So in that case, you would have to be the father and the mother of the child. So you have to play two roles, a dual role in the child's life. What does the father do? School fees, you know, all that. And be both sides for the child. And then be there for the child all the time. When she asks you a question, be there, answer the child, and let the child know this will never happen to her because you are around, you are going to protect her, you are going to make sure that she doesn't go through what you went through. And then start telling her to start praying so God will give her a father. In other words, you will get married. And if you are listening to me, I am prophesying to you that you get married and your child, whether it's son or a daughter, I'm presuming it's a daughter. It's a daughter. Your daughter will get a father.
Amen. I'm tapping into that prayer right now. But I just want to tell you, Julia, that you are not alone. People have gone through it. My mother has gone through it, and you know, I'm here today. And I want you to assure your child that if she is confused about anything, she should look up to somebody like me. That I lived without my father for a very long time. My father was only in my life in 2017. Wow. So if I did it, she can do it as well.
And she's doing so well.
Yes.
And then there was another one, Mohammed.
Yes, 2 kids.
Mohammed has 2 kids. Mohammed, I want you to know that you can have 10 children and they would all be different. We have what we call the temperaments. And I always teach parents, learn the temperament of your child. We have the choleric, we have the sanguine, we have the melancholic, we have the phlegmatic.
Is there a simple way of getting to learn about these things without the terminologies and looking them up?
Ooh.
Like, you know, someone is quick-tempered, someone is there any simple way?
Okay, we have the introverts and then the extroverts. We have the outgoing ones and then we have the ones that are calm. So you need to know, is your child outgoing? Is he an extrovert or he's an introvert? It all has its positives and its negatives. My first daughter is an introvert. She doesn't talk much. And because she doesn't talk much as a child, even if something was happening in the house, she wouldn't tell you. If somebody was doing something to her at school, she wouldn't tell you. I got to know much later that a bully in the school used to wee-wee in her water bottle.
Oh.
And she never told me. So that's the negative side of an introvert. On the other hand, she was the one who was bringing prizes, best behaved. She took best behaved from nursery till the time she finished Morning Star. And even in Achimota, when colleagues were judging the best behaved, her colleague will come together and then pick her up. My third daughter is not like that.
So she's like me.
She's like you. She talks. She will always bring me trouble.
Oh, mercy.
Meanwhile, she's the type who will tell you everything that is going on in her life. So you need to know them and know how to deal with them. Like I said, Mohammed, each one has its positive, and each one has its negative. The negative is that they will never tell you when something is happening. They are those children that when somebody even rapes them, they would never ever tell you. On the other hand, the one who is outspoken will come and tell you, Mommy, this guy has this uncle of mine has been making advances on me, and you would know before
it even happens.
You must know that it's good. Both of them are good. So the one that is, you know, always there, always kicking, always drawing on your walls and always jumping and always taking a blade, and you know, he's also very good. The only thing is that let them know that, you know, and he can be calm a bit. This is good, but please, this one, the way you spoke to auntie wasn't good. I didn't like the way you took a blade, and you know, when you were playing with your friend, I didn't like it when you threw a stone at your friend. You know, you need to know them early. Once you know them early enough, you can handle them as such.
Okay. Well, I have this message here. He says, I'm Aaron, and I'm really dying off with my wife and a baby boy. If care is not taken, I may commit suicide because I'm a newly posted teacher, and for about 6 months, no pay. I'm always angry with my wife. Please, I need your advice.
What's the name?
Aaron.
Aaron, I'm here to let you know that God will come through for you.
Amen.
You are not alone. Everybody is going through that. People are not being paid. You even had a job and now you are not being paid. Before COVID-19 came, there are people who were not even working, graduates, first class holders. They haven't had jobs for 5 years. So I want you to know that you are not alone. Don't send your frustrations on your wife and your kid. I believe that, I always say that you can never overemphasize prayer. If you pray, God will come through for you. Every day when you wake up, tell God, God, bring me food. God, bring me money. God, bring me an income. God, bring me. You'll be surprised how God will come through for you. That somebody will come knocking at your door and tell you, I have some money for you. A pastor will call you and say, oh, I have some money for you. Somebody will call you and then will say, I have food for you. And then don't be alone. Talk to people. If you have neighbors, if you have siblings, let them know. If you have parents, let them know that things are very tough for you. If they can help you, if you have a pastor, call your pastor, let the pastor know that things are very tough, and if they can get you some food and everything will be okay. Yeah. If you are in Accra, I can get you a number and bring you food. Oh. But if you are out of Accra, maybe I can still, if you have Momo, I'll take your number and see what I can do. But don't send your frustrations on your wife and your children.
He doesn't mention where he is texting from, but I see that he's typing, so hopefully he will say. So I saw this message and I thought it was interesting. He says, please, how do you draw lines between the children and the parents in this relationship? Because my boys are not giving me breathing space with my wife at all.
Oh my God.
And people are screaming, exactly. It looks like a lot of people have issues. What do you do?
That's why I always say that there must always be the me time.
Okay.
Make sure you have time for your children.
How do we do this me time?
No. What I'm saying is that if you have 2 o'clock for your children, let them know 2 to 4. It's time with daddy and the kids. If you have to play ball with them, you have to play ampe with them, you have to gym with them, you have to skip with them, you have to read for them, let them do it.
Okay.
Once it's 7 o'clock and you think that this time is for daddy and mommy, let them understand you've had your time. This time is for daddy and mommy. You can't come into the bedroom unless there's an emergency. You can't unless there's something. If you want anything, text. Once they understand that they've had their time, they will give you time to also have time with mommy. But if you don't give them enough of time, they don't have enough of you. When it's time for you and mommy, trust me, they will spoil it, and I will do the same thing.
But let's assume that they live in a single room. You know, single room self-contained. What do you do?
Oh, that's the problem. If you live in a single room, then you have a problem. And unfortunately, there is COVID-19, and they can't go out to play. They can't be in school for you to have time with mommy. Maybe I don't know. Get them a game.
Okay.
A game
to play where outside.
Outside, and tell them you have some discussion to make with mommy. So they should give you an hour. You have a discussion. And have all the discussion with mommy, and make sure that after 1 hour you go out. Get a neighbor or a friend or a sister or a brother to take care of them outside, let them play. If it's 1 hour, it's 1 hour, please. Give them 1 hour. Don't go 5 rounds. Don't do all the things you haven't done in 3 months. Do it small.
Okay. I have to stop laughing. But there's something good just happened right now. So this gentleman, he doesn't add his name, but Isaac. His name is Isaac. Isaac just texted that he's going to send 500 CDs to Aaron.
Isaac, God bless you.
Yeah, Isaac, I have your number. So let me know if it's okay to share your number with Aaron, or if I should just give you Aaron's number so that you send the money to him. Aaron, thank you very much. Aaron actually had a question. He's asking how to assess whether your children are having sex outside. I mean, like, if now that they're not going to school, he wants to know, how do you know if your children are having sex, and how do you monitor your male and female children?
This is a very difficult thing for most parents. How do you know if your children are having sex? You won't know, trust me. You won't know. The only thing you do is continually let them know that it's wrong to have sex before marriage. Continually let them know the side effects of sex. They might get pregnant, they might get HIV, they might not finish school. And most children have, they are 2 in 1. When they meet their parents, they are angels. When they are with their friends, they are something else. What I used to do when my children were young, I used to monitor them. I used to monitor their phones. I will monitor their phones, check their bags, look into their rooms. My parents will tell you, Mommy doesn't sleep. I have some of the friends of my children. They know their time their parents wake up, and they know the time their parents sleep and then wake up. And you know, a lot of them are children of rich parents, and they will fix their security men, and they will come in with their boyfriends. Sometimes they will go out, sometimes they will come in with their boyfriends. Their boyfriends will come and if you are listening to me as a parent, I want you to know that things are happening. So what I used to do, they know me, I don't sleep. 11 o'clock, I go to check their room. 12 o'clock, I go to check their room. 2 o'clock, now I'm having to deal with insomnia. 2 o'clock, 3 o'clock, I check their room if everything is okay.
Isn't that a bit too much?
No, it's not too much. As a parent, it can never be too much until they reach adulthood. And what I did is I also set up monitors,
in the
CCTV
house.
Cameras, so I know who goes into their room and who comes out.
Okay.
And if you are listening to me as a parent, the time we live in, I'm telling you, the children are smart. Our children are more intelligent than we are. Our children are more outspoken than we are. Our children go into the media. They know what is happening in America.
They're more adventurous.
They are more adventurous. They are more advanced. So if you're also a mother, you need to move with time. So don't be an old school mother.
I watched this movie where it's not a movie, it's a reality, something that actually happened that has been dramatized, where the mother was on her child so much that she was 16, she was dating a 19-year-old. So the mother went to the boy and said, you know what you're doing is illegal, I can get you arrested. It got so bad that the girl and both of them committed suicide.
Oh my God.
That's why I'm asking, how do you maintain a balance?
This is where you need to know, for instance, know the parents first, know the friends of your
child.
Know the parents of the friend of the child.
Okay.
Make sure that the parents of the friends of your children are your friends.
Okay.
So, for instance, my children bring in friends. They bring in friends home. When they bring in friends, I allow them to play, have their chat and everything. And they also go to the homes of their friends. And when they are there, I make sure that, you know, I communicate with the parents, make sure the parents are also keeping an eye. And my children know it right from day one, they know it. Before you go to a birthday party, I need to know the friend.
Okay.
And I need to communicate with the parents of your friends.
Okay.
Make sure they are level-headed. Make sure they are like me. Make sure they are not loose. People are allowing their 18-year-olds to have alcohol during parties. I won't allow my child to come to a party like that.
Okay.
So I know the parents. Once you know the friends of your children, you know the parents of the friends of your children, you are able to help your children a lot in these things.
I need to wrap up soon. But this question, since we're talking about sex and young people, it says, according to Mama Rita, no child is stubborn. But I have a girl of 23 years who has gotten herself pregnant in her first, who got herself pregnant in her first year in secondary school. and I have a 4-year-old son, but she wouldn't stop going out every now. Okay, so the girl now has a 4-year-old son, but she wouldn't stop going out every now and then. What do I do? Although she's back in school due to COVID-19 pandemic, she's home, but she won't read her books, and I'm very worried.
We will go back to what I started from the beginning. Communication with your children, being friends with your children. Maybe the child was naughty and was going out very often because you were not there for them. And when we talk about not being there for them, we are not saying don't work, but even at work, check on them, call them. My husband and I, we travel very often. When we travel, we call our children.
Okay.
We call them, we are there for them when they wake up. We make sure even if it's in America, we don't sleep. We wait.
Okay.
And then call them, wake them up. Sometimes I can do homework with my children on phone.
Okay.
Sometimes when they are coming from school, I call the driver. Where are you? Where have you read? So be there for your children. Okay. And then please add a lot of prayer. Add a lot of prayer. We live in evil times. We live in times that things are chaotic. So you need to add a lot of prayer to it. Okay. And maybe your daughter thinks that you are talking too much, you are nagging too much. Be a friend, and then pray. 23-year-old child, pray for that child. I believe that if you pray continually for that child, your heart desire and what you desire for the child will come to pass. Don't wait till when they get rotten before you start praying. Right from when they are a clot of blood in your womb, both mother and father, start praying for the children. If you pray for them, I believe that your children will turn out well.
Okay. So, how can, we have just 3 minutes, so how can a young man who has fallen in love cope with a young lady who already has 2 kids and they are about to marry? So this has nothing to do with COVID-19, but since we're talking about relationships, he wants to find out, I think he has fallen in love with a young lady, but the lady has 2 children. How can, what can he do about it?
You can't love somebody and not love their dog. So if you've fallen in love with that lady and you are sure it's genuine love and it's not lust, fall in love with the children too. Build a relationship with the children even before marriage. And what you do after COVID-19 is gone and restaurants are opened, even if you don't have money to go out, if there's a park in your house, pick the children, get 2 bottles of Coca-Cola, go out, have fun with them. If they are boys, play football with them. If they are girls, get a game that they would like, get a book you can read to them, you can read and discuss. Build your relationship with them right from day one. Let them see you not as a stepfather, but let them see you as a mother. If you genuinely love that woman, fall in love with the children too.
Okay. Hi, Mama Rita. She says she's a daughter of Royal House Chapel. I'm 21 years. I stay with my sister before the pandemic. I was teaching in a private school, but for now the schools are closed and I'm at home. But my mom calls me sometimes and she thinks I'm lazy because I've not had any job to do since I came home, and I feel bad. Sometimes I cry because I'm trying to get another job, but the era is difficult. Her name is Cynthia.
Cynthia, let your mother know that you are not alone. COVID-19 has brought a lot of hardships. People have lost their jobs, especially private teachers are not getting salary. But if you are in Royal House Chapel, and especially if you are in Ahimfie, I hope that you were active. If you are active, we are giving food, rice, oil, corned beef, everything to private teachers who are not receiving salaries. So if you are one of them, meet me in Ahimfie on Sunday for your food.
Okay. I hope that answers you. I don't know why a lot of people are sending messages like this. It says, Gifty, I'm scared now. Sometimes I feel like killing myself. Life is too hard for me. Imagine a man with 3 children and a wife. Because of a pressure, I hardly stay at home. I need advice. If not, I need mom's advice. Okay, well, I don't know. That's another
it looks
kind of
like
question.
This time is bringing a lot of pressure. My darling, if you are watching me, I can tell myself I'm looking very beautiful. my makeup is looking very good, but I've been very poor before. But at the time, I was very, very poor. And we couldn't even afford, my husband and I couldn't afford your kogari. That was the time we built our relationship. That was the time we prayed together. That was the time we were there for each other. And we promised each other that things would be okay for us. I want you to know that in this period, this is the time that you need to come get closer to your wife and get closer to your children. Give them a promise that life is not going to be like this. Life is going to be better. Life is going to be improved. You are not a lazy husband. You are not a lazy father. But it's just unfortunate that things are hard at this time. And just like I spoke to, I don't know who, if you have a family, get your family involved. If you have siblings, if you have friends, let them get them involved. If you are in Accra and things are very hard, I'm not promising everybody, listen to me, I'm not promising everybody, if you come, I would interview you very well. And people who know me know I have time for interview. If things are extremely, extremely, extremely hard, you feel like committing suicide just because of food, you can make a date with me Sunday at Royal House Chapel at 11 a.m.
Mama Rita, God bless you a lot for all the outreach, the messages of at least having someone say you can come. Even if you're unable to come, sometimes it helps deal with the problem. We're ending this, and this message says, Gifty, I'm really touched by today's program. I'm a teacher, and today's program has added special skills to my profession. From a teacher Ima inside Bogo. So thank you very much for sending that message. Mama Rita, we are so grateful. And hopefully we'll be able to drag you in again, maybe on Zoom or something, and we'll get more answers to some of our questions. It's been a great conversation. I've had very good insights as well. Blessing to me. I've been talking to Reverend Mrs. Rita Ankra. She's President General and founder of Royal Ladies Ministry, and she's been helping us answer some of our difficult relationship and emotional questions. Thank you so much.
Thank you so much for your thank you for having faith in me and trust in me, and thank you that I can handle your show. Yeah, God bless you, and you are doing a very good job.
Thank you. This is The Pulse with me, Gifty and Opia. I'm going to take a very quick break. I'll be right back. You stay. Now, the coronavirus, since its outbreak, has sent negative signals across the globe with the deaths and the broken and the sorrow that it has brought to many in the world. It is very difficult in these trying times to stay positive. But in the midst of this misery, pain and agony, one family has united more than ever and has shown the positive side of the outbreak of coronavirus pandemic. Northern Region correspondent Martina Bugri has more in this report.
Today in the Northern Region capital town of Tamale, we explore the positive side of the coronavirus pandemic. We are visiting a family at Lamashegu, the radio city, to learn something positive that has happened in their lives. Since the outbreak of the coronavirus, it has ravaged several countries. People have died, people have been hospitalized, people have been stigmatized. All about negative things. But in the midst of this negativity, a family has something beautiful and positive to say. Mr. Khadr is a banker. In the past, he spends most of his time at work. Even after close of work, he makes time to join the boys for a chat before he comes home, spending little time with his family.
Yeah, you know, they will close from school. When they are back, they will be looking at where is daddy and stuff like that. And by then you will be at work. Sometimes you will be at work, the mother will call, like the children want to talk to you. Like, you know, you just pick the call and like, oh, how are you? How is school? And you tell them that you will get back to them. You are busy. We used to sit outside after work. We used to sit outside and meet friends and do a lot of things. And now we are on schedule. It's like team A, B, and C. So if this on shift, this group will be at work. Maybe the following week we also go. Because of that, I think we spend more time being at home.
But since the outbreak of the COVID-19 and the restrictions, things have changed. He spends more time at home. It has also connected his family religiously as the family prays together.
For this pandemic, the children, they are very happy. They are always happy. They are happy that I'm always with them. Because more times, during the work schedule, you couldn't even have time to assist them in certain things. But because of this, I think I'm always at home. We always pray here, and they will come and we'll pray together.
It is not just the kids who are excited because they get to spend time with their father. His wife Farhana says she's excited too because the husband stays home more often.
Why are you happy? Why are you happy? Because now he won't go out because of the social distancing. So it's always at home.
So you are excited about it. The time they spend together is increased. They are more bonded as a family because of restrictions. The husband says, I stay home more. The wife says, I'm excited about the time I get to spend with my husband. And the kids are overly excited. They are jumping everywhere. This is the positive side of coronavirus. For Joy News, Martina Bugri reports.
Martina with our report. Health officials in the central region are asking relatives of patients on admission to reduce the number of people who visit such persons. According to the health officials, despite how biting the pandemic has been on health delivery systems in Ghana, some relatives of sick patients troop into the facilities in their numbers, sparking health concerns. At the Cape Coast Metro Hospital, where the Baobab Foundation is giving the hospital packed lunch every day for 2 months, the officials say if the numbers of relatives to health facilities could be reduced, the spread of the virus can also be curtailed. Richard Kojonyako has more.
In patients who have COVID-19, we basically classify them as those who have no symptoms and those who have symptoms. Those who have symptoms, we say that some may be mild, some may be moderate, some may be severe or critical. So when we talk about those who have severe or critical illness, we are talking about those who have what we usually would describe as a severe pneumonia from COVID-19, or those who are requiring support for their organ system to be able to stay alive. And these are the patients who come to the intensive care unit. Yes, what's the situation in Ghana now? A number of ICUs, or critical care areas, which are part of treatment centers, are looking after people who are severe and critically ill. I happen to nationally coordinate what is being done by these different centers. So these centers would include the medical intensive care unit of Kolibut Teaching Hospital, the intensive care unit of University of Ghana Medical Center, the intensive care unit of the East Municipal Hospital, the critical care area for 37 Military Hospital. And then in the regions, we'll have other places like in Confanoche, in Ho, and in Tamale. So as we speak now, all these centers I've mentioned have patients who are severe or critically ill. I think at our last update this morning, we have about 22 of those, I think between 20 to 22 of those in these different places. Majority of these are doing well. It's a lot of work trying to monitor them, give them the support they need, and get them to a place where we can be able to transfer them to mild areas where our colleagues there continue to take care. The worry is that as more numbers increase, the number of people who are severe or critical would also increase, and that is partly what we are seeing, and therefore the requirement to get these people admitted in intensive care units or critical care areas become more or increases, and then may stretch the capacity of the existing one.
Climate scientist at the Kwame Nkrumah University of Science and Technology has developed a model to predict meningitis outbreak using relative humidity as proxy Dr. Isaac Tetter of the Environmental Science Department says absence of data inspired him and his team to embark on a search for ways to foresee occurrence at least 9 months in advance. He says the model will enhance government's efforts to fight the perennial disease, which has already killed over 40 people in the Upper West region this year. Prince Apia with more.
Meningitis is a bacterial infection associated with several environmental factors such as dusty harmattan winds and low humidity. Over the years, the disease has killed many people, especially in northern Ghana. According to the Ghana Health Service, at least 409 cases of meningitis have been recorded as at April this year, killing over 40 people. Dr. Isaac K. Tete is lead researcher.
The constraints that we have on meningitis data analysis is that we don't have much data across the country and even globally. So what we intend to do as environmentalists or climate scientists is to find proxies for meningitis. And proxies are surrogates. So in place of meningitis data, what environmental variable can you use to make your prediction? Relative humidity and meningitis relate in an inverse relationship. Wherever we have high relative humidity, it is expected that we have low meningitis. And wherever we have low meningitis, we also have high relative humidity and vice versa. So with this situation, then we are using relative humidity as a proxy for meningitis, so that once you don't have data on meningitis, we can simply use relative humidity variability in the atmosphere to predict the onset of meningitis and where the disease is likely to occur.
The government and its partners engaged in vaccination outreach can fully utilize the model to target communities with high risk of meningitis. Dr. Tete says the model is essential for planning purposes because it can predict meningitis occurrence at least 9 months in advance.
In fact, it is seasonal or yearly. So what research can do to augment whatever strategies the government is doing is to make prediction a season ahead of time, because it needs time to organize yourself in logistics and so on and so forth. And therefore, what we can do is we are currently in 2020, so we want to see the climate outlook in 2021. Nobody is there, but we can use this modeling approach to make a prediction of the state of the relative humidity in 2021. If we are able to spot areas that are having low relative humidities, it is anticipated that these are the regions that will be vulnerable to the disease. So once you make that information ahead of time, then the Ministry of Health, in consultation with other stakeholders, will start planning for the episode ahead of time, instead of waiting till last minute and it takes everyone by surprise.
Meanwhile, Dr. Tete says more resources are needed to support research such as this to address environmental challenges. The scientist says the department is ready to collaborate with relevant state agencies to adopt and apply the model to put health authorities ahead of the disease. Prince Apia reporting.
Do log on to myjoyonline.com. There's more news and information there, and you can scroll all the way down on that page. Our video link is also there as well. Our top story there for you as well. Take a look at it and have yourself a great weekend. I'm hopeful that this conversation has impacted a lot of families in a very positive way. Let's talk showbiz is how we wrap up the entire show. Do stay and have fun with it.